Ladies and gentlemen, to close our summit, please welcome back to the podium the Honourable Paul Davis, Premier of Newfoundland and Labrador.
Good job, Minister, and hats off to you and your staff for a great job they've done today. And I got to tell you that your feedback today has been invaluable. And much like Steve, I've used, as I've been here throughout today, I use my opportunities to speak to many of you in the room as opportunities presented, and sat at some tables and listened to some of those discussions. And I was truly impressed with the quality of the discussions that took place throughout today, and those that I saw, and some of the responses that we've seen here today. And I want you to know that your opinions and your advice and your guidance, your comments, your ideas are all very important to us. And they're important to us as we begin to develop a new province-wide primary healthcare framework over the next coming months. The discussions that have been held here today, along with those held by residents in the province in recent weeks, will help to form that foundation of a framework that will focus on the access to high-quality, collaborative, and coordinated services. We've heard loud and clear, as we are all aware, of how important it is that we get it right and that we provide these services well. And we also know that we review the allocation of healthcare resources will be part of what we do, and also the need to enhance focus on the basic everyday supports required by you, healthcare professionals, and also required by the citizens of our province. And based on what we've received here today, we'll continue to explore innovative opportunities and innovative ways which we can focus on key aspects of prevention and health promotion, and also how we can better integrate our health sector with other areas of social sectors such as education and housing, as we've been talking about today. It's also, I believe, important to point out that this summit is consistent with the priorities identified in the strategic plan, the current strategic plan for the Department of Health and Community Services, and that was to explore options for improving access to primary healthcare services in our communities. Regular updates on our progress will be made available to the public so that everyone can gauge and see how government is doing and what steps we're taking to improve primary health care. But that's not the end of the discussion. As I commented this morning, it is only the start of a process, and I want you to continue to assist us in that process, to follow it along, and continue to be engaged. From your participation here at this summit, we recognize your interest. You've all taken time out of your days and your work schedules to come here and participate. So we will be reaching out to some of you again in the future and in the coming months to further assist us in the work that we have to do. I'm a big believer in, if you want to find a way forward, you should ask the people who are doing the work every day. And that's you, the people in the room. The information that you've provided will be analyzed by the department and will be shared publicly. And we're also going to and have been considering experiences from other jurisdictions across the country so we can avoid some of the pitfalls which they faced and have a look at some of the best practices that they enjoy and ways forward that are working for other parts of the country. We'll be asking a Primary Health Care Advisory Committee to assist us in reviewing the information you have shared and in determining the best way to begin the process of developing that framework and how do we move forward. I can tell you the Primary Health Care Advisory Committee will play a key role in providing expert advice and establishing working groups to foster an ongoing and inclusive dialogue with stakeholders such as yourself. And I put great value in advisory committees. As many of you are aware, I was Minister of Health for a few months last year, and one of the first interactions with advisory committee that I had was with the Mental Health Advisory Committee. Very, very interesting group, and in fact, if you see some of the banners that are here, Understanding Changes Everything, and I'm sure most of you in the room are familiar with Understanding Changes Everything, and they were very much involved in the success of that project, of Understanding Changes Everything. And when you learn from your own experiences as well, and you learn as you move forward. And when I first was introduced, it was kind of interesting because I was sworn in as the health minister one day. My first briefing the next day was on Monday, you're introducing a new project, Understanding Everything, or Understanding Changes Everything. And I thought, well, great. what great work I did over the weekend. But it was driven by stakeholders, and many of them involved with the advisory committee. And when you think about understanding changes everything, and just to get off this for a second, but how important that is, driven by an advisory committee. And I've told this story before, and I talked to Dr. Latta today, who was here, and I told him a story how I was at a group discussion one time, and I know there's people in the room that were there. And we were talking about mental health and addictions, and we were talking about how understanding changes everything. And we were talking about, when we're talking about the project of Understanding Changes Everything, about some of the characterizations, such stigma that exists with mental health and addictions. And I was at this group, and I told them, and I couldn't tell it any more truth than I'll tell you, but I told them about my own father, because for several years, my dad went 3 times a week to the Waterford for treatment. And the room went silent, much like it's done here today. He went there for dialysis. Exactly. Now you feel different about why my dad went to the Waterford. And I thought, what a great example of how stigma can have an impact on people's lives. And we've got to overcome that. We've got to work together to make our best efforts so that we can overcome stigmas and these types of pressures that exist in people in our society. So the Primary Healthcare Advisory Committee, it's important that we get that right. They do great work, and as I mentioned this morning, they have a broad representation from regulatory bodies, from Memorial University, from stakeholder groups, from various health professions. But we do have a missing component on that committee, and that's a patient's voice. We don't currently have a patient's voice. So today I ask you and everyone here in the room, if you yourself or if you know a resident of the province who is interested in sitting on the committee, I encourage them to contact the department through the Health Summit email address, which is pen's ready, right? healthsummit@gov.nl.ca, and there's also a phone number, 1-844-729-6310, and that's available to you. You can find it on our website anyway. So if yourself, anyone here, or if you know anyone who's interested in participating on it, we invite you to put your names forward. We can only reach our goal of better health care, better care, better value for all of us if we continue to dialogue beyond today and maintain engagement with our government. And as I told you before, I'm a fan of that. We have to engage with regional health authorities, with residents, and healthcare providers. And I saw the response earlier when it was asked if there was value in coming here today and should we do this again. And I think you've answered that clearly, that you'd like to see this happen again. So I can tell you today that I'm committed to, in a year from now, let's come back to this room again and follow up on the summit that we've done here today. So I hope that in 2016 we can report back on the progress that we've made based on the information gathered here today, and we can continue to make progress on primary health care. I want to thank you again for your time and your input, for being with us as we continue this journey. I can tell you personally, for me, as a healthcare or a health consumer, that I'm a fan of all our professionals that work in healthcare throughout Newfoundland and Labrador. I believe that our role in government is to give you the best opportunity to provide the best services possible, and that's what this is about today. And as we do that, I continue to be a fan of our people that work in healthcare. So I personally thank you, and on behalf of the people of the province, thank you for the work that you continue to do. I want to thank our guest speakers as well, and those, all of you who have participated. But I do thank you for all of that, because it was very thought-provoking in the discussions that happened today and the results that have come from them. I want to look forward. I do look forward. I know the Minister does as well, and the people in the department. And as Minister Kent talked about in the Department of Health and Community Services, we're very excited about the opportunities that are presented as we do this. And I know from my own knowledge and discussions with people in the department that they are looking forward to continuing the work that has been started here today. So we're going to continue as a government and as a cabinet. I'll continue to work with my colleagues, work together to build a stronger healthcare system for all of our citizens, and one that will meet the needs of our residents and our healthcare providers today tomorrow and for many years to come. So I hope to see you all throughout the year as we continue to work together, and I hope to see you all back here next year for our second annual summit to revisit what we've done and continue to make progress together. Thank you again for coming. I wish you all a great day, safe travels to all of you, and thank you for participating. Thank you, everyone.